This is the first module in a series on how to control infectious causes of lameness. There are basically two groups of bacteria that can infect the feet and cause lameness. The first are the bacteria causing foot rot. These bacteria are found in the feces of normal cows, in other words, everywhere on your farm. These bacteria cannot usually get past the healthy protective top layer of the interdigital skin between the claws. But if the skin is damaged, the bacteria can very quickly get into the deeper tissues, producing toxins that cause necrosis or kill the surrounding tissues and cause tissue breakdown and inflammation. When these bacteria get into the deeper tissues, there is a characteristic swelling and pain above the coronet and heat. Let's look at foot rot first. The first risk factor for foot rot, of course, is that there exists the particular bacteria in the environment. The main bacteria we find in this condition is called Fusobacterium necrophorum. A second bacteria, called Bacteroides melanogenicus, is also sometimes found. Both these bacteria are found in the feces of normal cows, so this risk factor is almost always present. The second risk factor for foot rot is injury to the interdigital skin. An injury plus the bacteria is the sufficient environment for foot rot to occur. There needs to be an injury, even just a small one, for the bacteria to enter. This injury could be caused by stones, sticks, wood chips, or anything that jams up between the claws, or even impaction with grass or straw that damages the skin. On pasture-based dairy farms, a common risk for interdigital injury is from stones about 1 centimetre in diameter that are found in the gravels used to repair paddock entrances and also around water troughs in paddocks. Another, more secondary risk factor is rainy weather, causing breakdown of the surfaces of the walkways or the tracks. These muddy patches of the walkways usually contain stones that can jam up between the claws. Excessively crowned track surfaces increase the risk of foot rot type injuries occurring. Often, where tracks are excessively crowned, the cows choose to walk in the side drains. In these side drains, there is usually fine material or gravels that gravitate there in the wet weather. Poorly drained entry and exit areas in front of the holding yard of the dairy are another risk. Small stones that are mixed in the mud may easily become lodged in between the claws. Cattle grazing or cleaning up paddocks after silage crops, such as maize, have been cut, are at risk of interdigital injury. I once treated cows for foot rot with splinters of bamboo penetrating the interdigital skin. Earlier in the season, bamboo along a fence line had been mowed. Within a week of the dry cows being put into the paddock, many developed classical foot rot. Calves reared on wood chip are at risk of interdigital injury. Impaction of straw or hay between the claws of housed cows can aggravate the interdigital skin and allow entry of the foot rot bacteria. The second common infection of the skin of the foot is with digital dermatitis bacteria. These bacteria are highly infectious, but do not cause swelling of the foot because they only infect the very superficial or surface layers of the skin. This is the main difference between the two infections. One causes swelling and one doesn't. The digital dermatitis bacteria cannot usually get past the surface of healthy dry skin. But where the skin of the feet is somewhat damaged or compromised by standing in deep slurry, the highly infectious bacteria seem able to enter the superficial skin layers via the hair follicles. These digital dermatitis bacteria can also infect wounds, and then they go deeper into the foot capsule. Now we will look at digital dermatitis. What about the risk factors for digital dermatitis? These are similar to foot rot. You need to have the bacteria present on the farm. So the first necessary risk factor for digital dermatitis is the introduction of spirocheete bacteria of the treponeme family into the environment. These bacteria have been associated with other diseases, contagious ovine digital dermatitis in sheep and goats, and also bite wounds in pigs in some countries. These particular type of bacteria do not seem to be present on all farms yet. However, it seems that they can be carried easily from one farm to another by livestock or equipment. Similarly, sending calves, heifers and dry cows away grazing can increase the risk of introducing the disease if they are grazed with cattle from infected herds. The problem is that most farms never screen for the disease, so it is difficult to find out if your cattle will be grazing with animals from digital dermatitis-free herds. Another risk of introducing the digital dermatitis bacteria is on the hands, hoof knives and equipment of foot trimmers and vets who have been dealing with the infected feet of lame cows on other farms. At least for the present, it may be possible to avoid the disease by using good external biosecurity measures. Once the bacteria has been introduced onto the farm, we have the necessary condition, that is, the bacteria. Then the second risk factor for spreading the digital dermatitis infection between cows is poor foot hygiene. Reducing the second risk will involve keeping the feet clean of slurry and getting rid of any bacteria around that may have got onto the foot. So first we'll look at foot hygiene. Slurry, as distinct from simple mud, causes anaerobic foot conditions, or prevents oxygen from getting to the skin. For this reason, housing of cows and high stock densities will increase the risk of digital dermatitis. In pasture-based systems, poorly drained entry and exit areas to the milking facility, feed pads that are not regularly cleaned, and slurry around silage feeders in paddocks all increase the risk of spread of the bacteria between animals. If the weather is hot, for example in times of heat stress, cows standing close together under the shade of trees end up in more slurry. This will increase the risk of developing digital dermatitis. Where cows in pasture-based systems are fed concentrate in the milking parlour, it is common that the consistency of the feces changes, and the slurry on the feet is more tacky and so possibly increases the risk of digital dermatitis. Where there is digital dermatitis bacteria on a farm, and there is no foot bath, or an ineffective foot bath, there is a risk that the bacteria will spread easily. A further risk factor for developing the infection is the depressed immunity of cows at the time of calving and in early lactation. Where a farmer treats their own lame cows, there is a risk of spreading the bacteria between treated cows if the equipment is not disinfected after each treatment. Controls put in place to prevent the bacteria being spread between cows on an infected farm could be called internal biosecurity measures. Having poor or no internal biosecurity is a risk. Now for the take-home messages. 1. There are two major infections causing lameness: foot rot and digital dermatitis. Number 2. Foot rot is caused by damage to the interdigital skin and bacteria that can infect the damage. 3. Risk factors for foot rot are presence of the bacteria and factors that increase the chance of damage to the interdigital skin. Digital dermatitis is caused by infection of susceptible, compromised skin with spirochete bacteria of the Treponema family. 5. Risk factors for digital dermatitis are introduction of the bacteria onto the farm and poor foot hygiene compromising the health of the skin.